now for panel discussion 4, Healthcare Infrastructure Meets Urban Planning, Building Health Cities, Not Hospitals. May I request our esteemed panelists to join us on the stage. The moderator of this panel will be Dr. Vinod Singh, founder and consultant, Hospitec Healthcare Consultancy Private Limited. I request Dr. Vinod Singh to join us. Give him a big round of applause, everyone, as he's joining us on the stage. Richa Singh Debgupta, Group Chief Strategy Officer, Fortis Healthcare. Major General Dr. Jakhtar Singh, VSM, Executive Director, AHA. Give him a big round of applause, everyone. Nivedita Dilip, Associate Councillor, CII, Indian Green Building Council. Give her a big round of applause, everyone. May I request Richa ma'am to take over?
Hi, good afternoon, everyone. People here in the audience have no idea how hard it is to come up at this time in post-lunch session, but we will do our job. And I promise I'll finish the discussion the first time they announce the silo. Okay? Now, our topic is healthcare infrastructure meets urban planning. Look at the person sitting right next to you. This person might be just your neighbor right now. But if you were living in a health city, it would be a part of your preventive healthcare ecosystem. And I'll explain you why. Imagine there are two families living in the same city. One family has access to clean air, green spaces, pavements to walk on, good neighborhood, public transport within the township, good supply of water, and good public drainage system during floods. Another family travels 2 hours in traffic every day, breathes polluted air, has no access to public drainage system during floods. Now, who do you think has a more chance of survival? Obviously, the first family. Now, why is it that when we build the hospitals, we always think of treating the illness, but not just preventing it? Imagine if you were living in a health city, you probably had less chance of going to a hospital. We may do preventive healthcare, but we are not actually living in a city which is made for health. If you go to other countries, developed ones, they're taught CPR in schools. They're taught health-related aspects in schools. We are not taught here. And that's where the main difference lies. Now, I have the privilege of a wonderful panel here, and we have a mix of green building, group strategy, healthcare strategy, public health systems, and military-grade resilience system, all in one. So without wasting much time, I'll just start this. Before that, I will just say that when we think of healthcare system, when we think of healthcare design, we're not just looking at a hospital in the form of a repair shop. Because at the end of the day, you visit the hospital only when you get sick. What we want is for you to get the ambulance within 10 minutes. If you get that ambulance in 10 minutes of you falling sick, I think you're living in a good city. And that is where I believe that there has to be a criteria of classifying cities which has better access to emergency care. And the first step starts right there. Now, I'll start with my questions. And my first question will be to Dr. Rajiv. So, Dr. Rajiv, what does One Health mean? I would like each of the panel members, when I ask the question, to just introduce themselves and just give a brief of what they do in their organization and then come to that question. So, Dr. Rajiv can start with One Health.
Thank you, Dr. Vinod, and thanks the organizers for inviting me to the HPIE 5.0. The concept of One Health, I think COVID-19 pandemic has shown what One Health is all about. And today, when people hear the news of antivirus, one cruise stuck in Europe, and people are not willing to accept those individuals just because one infection which is transmitted generally from rodents to rodents has been transmitted to human beings. So that connection between us means human beings, animals, microbes, and the environment. Environment is earth, air, space, and all the constituents which make up this space, other than animals, plants, and human beings. The moment we start thinking they are disconnected, I think we are disconnecting ourselves from our survival. And that is the genesis of diseases. And we start thinking of non-communicable and communicable diseases. This, we should also remember this division is artificial. The more you research, you really find that earlier you thought the disease is non-communicable, and you find it is communicable. And the biggest example is cervical cancer. We all thought that infection does not play any role in cervical cancer. And once you realize that there are viruses which can lead a person to have cervical cancer, you realize that there are factors which are animate and inanimate, the junction between animate and inanimate, which can lead to a non-communicable disease. And who can vouch for future that hypertension or diabetes also may not have been caused by organisms which are neither living or non-living, but they enhance person's liability to get both these diseases which are so ubiquitous. Like yesterday you redefined what is PCOS, you redefine what is obesity, you redefine what role endocrines play in our lives. So I think that defines our understanding of what science is and our understanding of how we need to tackle our health issues. And more than the health issues, it's the survival issues. And unless you address this, you will not be able to create a paradigm shift in thought process for 2047 and beyond. Unless you have a long-term vision which is based on science, facts, and research, which is evidence-based, the things won't graduate. So One Health, I'll again repeat, is the confluence or the interactive nature of plants, human beings, and animals, along with the environment they live in. All of us live in the same environment, like not excluding space.
I have one question to that. What is one clause that you mandatorily want to add in Indian municipal master plans? If you want one clause that needs to be added in every Indian municipal master plan, what would that be?
Yeah. If you are challenging that at one particular aspect, I would say that understanding of the concept of One Health. The moment you understand, your thought process changes so much that you stop thinking in silos. You stop thinking in aspects which are very insignificant in genesis of a disease or the system, and then you start finding solutions so easy that the impact is much more, investment is very little, and growth, so-called growth in more than financial terms, I would say, because it becomes sustainable. I think that would be the single most important factor I would consider.
Thank you. I'll move to Ms. Richa now. Ms. Richa, you come from a corporate hospital group. My question to you would be from the investor point of view, that is prevention ever going to be a serious business, or is investor interest always win at the end of the day?
See, I think nobody is disagreeing with the fact that prevention is always better than cure, right? And as healthcare professionals, we know it very well. In terms of the perceptive value that hospitals are purely meant for curative, I think it's wrong. Okay? Now let's start from any hospital's function. If you look at it, preventive health checkup has been existing in the setup for long years. It has been 25 years that each of the hospital would have preventive health check. My question would be, 20 years back, how many takers were there? Today, how many takers are there, right? So it is also about health-seeking behavior of people. Right? I think one good thing, if somebody would ask me, COVID has done awareness about health, and to some extent the fear that even a virus can actually kill me is something which has given a significant importance to that I need to care about my well-being. Right? So now talking about that, is investor only interested about curation or healthcare delivery to sick people? That's not true. Right? But having said that, if you look at the healthcare delivery sector, there is a primary care, secondary care, tertiary, quaternary. Now, when you look at most of the corporate hospital group, they are meant for tertiary and quaternary care. There is primary care, which historically has been delivered by the public sector. Okay? But with that said, now there are standalone preventive health check centers. There are standalone wellness center, which has come up, and it's well supported by PE and VC both, which goes on to say that they see value in preventive health check. Now, also talking about, even when we talk about curative, that's not the pure interest. Let's take a disease which is spreading like anything, which is cancer. Okay? We understand that sooner you catch that, better it is for me. It is less expensive for the patient, and for us as a hospital, it gives me better outcomes, which is the trademark for me to say that what's the survival percentage, what's the curative percentage for us, which also helps us. So saying that is preventive going to be a focus. It has always been a focus for the hospital. The focus is increasing because now people are also demanding it.
Just a follow-up question to that. What percentage is your preventive and what percentage is your curative overall as of today? So that we know that how much it was in the past and how much it is now and how much it can be in the future.
So frankly, let's not go by the percentage. As I said, that Fortis is a quaternary and tertiary care hospital. I would say almost 88% of our business or 85% of our business will be more curative and 5% will be preventive. Having said that at Fortis Group, we follow a balanced scorecard, right? What are your goals and how much focus is going to go into each of the things. So preventive health checkup, last year we had taken that we would be growing the footfalls in preventive health check by 12%. And actually we have ended up achieving 15%. That goes on to say that there are people who want to get that check. They want to kind of keep themselves healthy, and hospitals are welcoming that step, is what I would like to add.
Thank you. Dr. Jagta, the next question is to you. When we say health city, what are the core requirements of a health city to be truly classified as a health city? Is it the infrastructure, or is it the governance, or is it the community system? How would you rate a city to be called a health city? And please introduce yourself and your organization also.
Okay. Good evening, everyone. I'm General Jagtar Singh. I first of all thank Medgate for this invitation. I am from the Armed Forces Medical Services. I have retired after a service of nearly 40 years. And presently, I am the Executive Director of the professional body of hospital administrators in the country, which is AHA, that is the Academy of Hospital Administration. So having said this, to turn to the question what Dr. Vinod has asked me, what exactly are health cities? I think the answer to that actually flows out from what my two previous speakers have said on the panel. One has talked about health and one has talked about the care that is provided in a particular hospital. So what are we doing? We are actually have, in a certain way, isolated care into certain hospitals, right? Big, small, medium, whatever it is. But when we talk of health cities, we are trying to take out this care from these hospitals and embed it into the journal life of the inhabitants of that place. That is what is happening. So if you look at it, it's a paradigm shift that we need to get ourselves adjusted to. This is what I feel a health city would be. If you look at requirements, that was your second part of the question. What it requires is trying to build that environment. You may call it environment, you may call it ambience, you may call it ecosystem. Any word you may use it. But what needs to be done is that you plan for wellness of the population. You are not dealing with sickness. You will have to provide that green spaces. You have to provide what's in our previous panel, which was discussed, that we are trying to do away with these neighborhood hospitals, but they are so essential. We have to bring them back into our neighborhood so that all these things are available to the population or the people who need it close to what they are. They need to be encouraged to, have a healthy lifestyle by having open spaces, walking plazas, cycling tracks, marketing very close to where they are. So all these requirements, be it the infrastructure, maybe it the social angle, maybe the entertainment, maybe the placing of health facilities. So what all you said, all will go into actually building a healthy city. So I would, sum it up by saying that this is a concept that we need to now sort of look at if we really want to move away from only treating sickness to getting into the realm of wellness. Thank you.
Thank you. Ms. Nivedita, the next question is to you. You come from the Green Building Council. For a layman, why is there so much of talk about green building? And what are the things that we still make a mistake in terms of the operational or the infrastructure guidelines that we follow when it comes to green building? Just the simple mistakes that we still make. Although there are a lot of buildings that still come up with green buildings, but not too many of them. They're a very handful of numbers. So why is it that it's not taken up to a larger extent in terms of catching up in bigger cities and other tier 2 towns also?
So I'll start off by giving a broader perspective. If you see the building and the construction sector, it is one of the major contributors to the global warming. So the building operations contribute to nearly 28% of the greenhouse gas emissions, and the building materials and the construction activities, they contribute to nearly 11% of the greenhouse gas emissions. So overall, nearly 40% of the greenhouse gas emissions is from the building sector. And within this, if you see, the healthcare sector contributes to around 4% of the global greenhouse gas emissions. This is majorly because the hospitals are very resource intensive in nature. They are running 24/7, they have constant air conditioning loads, they have many complicated operation surgeries which are going on, so you have a lot of infection control requirements, sterilization requirements. All of this makes it very resource intensive in nature. So if you look at it in terms of the energy consumption, if you see in a hospital, this is nearly 2 to 3 times more compared to other types of commercial buildings, like an office building. If you compare it, this is much 2 to 3 times more than that. And this is majorly because nearly 50% of the energy consumption in a hospital is consumed by the air conditioning system, the HVAC systems. And if you see, the major mistakes we make is we don't look into the efficiency of the HVAC systems when we are designing or when we are planning the hospitals. And also we have a lot of artificial lighting which is used. We do not give importance to the building envelope, which determines the amount of heat ingress inside the building. And also we have a heavy reliance on fossil fuel-based energy systems as well. And if you look at it in terms of water consumption, the hospitals nearly consume around 600 to 1,000 liters of water per bed per day, depending on the type of hospital, for various uses like for sanitation, sterilization, and laundry and other purposes. So even though the water demand is really high for a hospital, still the incorporation of measures like rainwater harvesting, like having water recycling within the hospital, going for water efficient pumping fixtures, these are not widely adopted within the hospitals, which can help them in saving water. And another aspect is the waste. So even with respect to waste, the hospitals generate a huge amount of waste. In terms of biomedical waste, nearly 1 to 2 kgs of biomedical waste per bed per day is generated. And most of this is infectious waste and single-use plastics. So we see that in hospitals, there is still scope for better segregation. So when you don't segregate this waste properly, there is also chances of contamination happening. So overall, if you see, the impact on the environment is really high. So the hospitals have a very high impact on the environment. So if we do not incorporate sustainability right from the planning and design stage, then it is going to create a long-term impact. And if you look at the scenario in India, so we have like almost 70,000 hospitals, and hardly 150 of them are green certified, if you see. And also the kind of rapid growth this sector is happening, it's important to start incorporating the sustainable principles and concepts right now, because this will have a long-term impact on the environment, the economy, and the health outcomes as well. So it is important to look at how we can create more awareness, have more policy interventions, which can help in better adoption of green concepts within the hospitals.
Do we have separate health infrastructure green rating, or do we just follow the commercial?
So we have, IGBC is the only council in India which is having a dedicated framework for green healthcare facilities. It's not a generic one for all commercial buildings.
I'll come back to you, Dr. Rajiv. We talk about investing a lot on tertiary care hospitals. My question would be, is there enough investment in prevention also, just like the curative part that we talked about? Same amount of money, let's say if a hospital is investing about 500 crore in a hospital for a tertiary care, do we have the same amount of investment happening for a preventive care? Or is that not too much for an ordinary citizen?
Yeah. Interesting proposition. I think apples and bananas can never be compared. And here the comparison, I feel, is ill-placed, because the definition of prevention or health promotion and wellness is not very, you maintain or sustain that investment, determines your total investment or cycle. You have to say, if you create a hospital, say quaternary hospital, generally the planning is done for 50 years. And then do you feel that any hospital, quaternary hospital, will die at the end of 50 years? It won't. By the end of 50 years, it transforms into something more. Like if you go back in the history, whether in US or Europe or our country, 50 years back, did we have quaternary hospitals? 50 years back, did we have tertiary hospitals? What was the balance between tertiary, secondary, and quaternary hospitals? 50 years back, just think about it. And the history teaches you a lot. A lot. Our recent history, so-called medical science history, modern medical science history, I would say, it does not go back more than 300 years. And were we not living before 300 years? It is not so. We were living and thriving. Our knowledge systems, our ability to treat our bodies, to grow with the environment was very effective, whether in India or the Roman Empire or the Persian Empire or Greek Empire or the civilization that existed in Africa or Latin America or Europe was thriving. So did it not? Why did it not require investment in creation of tertiary or quaternary hospital ecosystem? Have you asked this question ever? I think that answer will give you a clue as to why we should not compare investment in prevention, health promotion, and well-being with hospital sector investment. It is ill-placed because the very fact that we have not been investing enough, and we continue this trend of not investing enough in prevention, health promotion, and well-being, we will continue to be always short of resources and always spending, say, 1,000 times more than we should. It's a vicious cycle. We will never achieve what we intended in the beginning to achieve. Just go back to the year 1600 in India. Were we not a thriving economy? Everybody would agree across the world that India was a very much a thriving economy. We were the most advanced economy. Our exports were much more than any other country in the world in just 1600. And I'm not going earlier to 1600. So this is the reality. I think we need to concentrate much more on the way we need to reorient the entire thought processes in terms of balancing our economy, in terms of our resources and our ability to manage those resources for all of us. And when we say all, again re-emphasize, all should always remember that all shall mean human beings, animals, plants, an entire universe composed of earth, air, water, and the space. Only then you realize that this is the composite whole. And without this composite whole, we will fail again and again. We'll rediscover our concept of development, and we will keep on failing and keep on fighting. And this will be an endless cycle.
Yeah, so I think if you ask me, the amount of money that you need to spend for prevention should not be left to hospitals alone. For example, let's improve the air quality. That's not the job of a hospital to invest in. Let's improve the traffic road conditions. Again, that's not the job of the hospital to invest in. Improve the public drainage system during floods. Again, that's not the job of the hospital to invest in. So if these things are done well by the government, I think a lot more preventive diseases can be avoided at that stage, and the people will probably fall less sick. Maybe they'll fall sick due to age-related diseases, or probably due to injury or some accidents for that matter, but not due to things that are already in our control, but then the government probably has not done much about that. So,
Dr. Vinod, I would interject here. Yeah. If you see that the diversity of background of all of us would lead us to think, for example, an architect would think we need to have a very strong HPIE system to give a very, very good experience to the patient admitted. But why do we require HPIE? We did not start thinking, did we require this 20 years back or 50 years back? Because the ambient temperature outside was more comfortable to the human being. The air was not that much polluted. Water was available in plenty. So the need for investment is increasing. Any architect would tell you, any hospital planner would tell you how much we have to put in to have the same effect of comfort in indoor patient today. Like Hospitec can understand better how much they invest in creating an environment which is patient-friendly. So, have we not destroyed our environment? Climate change does it appear to be a theoretical concept? Is it not a practical aspect which we need to consider on a larger basis when you are talking about interface between a hospital and the government? The larger issue, governance is the issue. The basic way we think and govern ourselves, not the government. Government is part of us. How we govern ourselves, that will determine the resources that we save or resources we will apply for the appropriate goal.
Yeah, you see, no matter how good you can build a hospital, but before you enter the hospital, you have to go through the public roads. And if those roads are not good, the stress level of the patient is so high, even before he meets the doctor, then he's just going there for, additional sickness that has been created by lack of infrastructure. So I believe everything else inside the campus of the hospital is so good, but then outside is not that great. So it doesn't really solve the entire purpose of having a healthcare facility in that case, which obviously we cannot leave it to the hospital's part, but then there has to be a lot of things that the public sector needs to do in order to create an infrastructure which is easy to access, which has public transportation in place, which has clean, breathable air. And that is the most important thing. And then you visit the hospital and get treated for any disease that you have. Now, coming back to Ms. Richa, since you come from Fortis Group, I would like to ask how do you think of the healthcare ecosystem than standalone facilities, than a, let's say, 100, 150 bed hospital compared to your institution, which goes on bigger sizes? What's your difference in thinking in terms of thinking of the entire healthcare ecosystem as a whole?
See, Fortis has the complete continuum of the, in terms of size of the hospitals. We do have 100 bedded as well, and we do have 500 bedded as well. See, it doesn't matter what size of a hospital it is, as long as it's optimal size, which is, we consider at least 150, 200 beds, right? You can have it. In terms of patient's requirement, now today patient wants that they should get end-to-end care, right? Not only inpatient, but then they're also expecting you to, the way, they think that if I can book a movie ticket, sitting at home, can I get an appointment on the click of the button? Right? So those are the kind of infrastructural change they're expecting. So in that case, I think most of the hospitals have gone for app where you can actually just check in, you can see the availability of the doctors, their timing, what it's going to cost them, and so on and so forth, and book your appointment. Second thing, when they walk into the hospital, they're also looking at it that, do I have to stand in the queue? Because I don't know what people are doing with the time that gets saved by using the digital technology, because I've never been able to answer that question. But having said that, I think people have become very, very impatient. Okay? They would not like to stand in the queue, and in hospital neither should they stand, because many of them are not well, they're in urgency and so on and so forth. So can there be a QR code which they can scan and register themselves? So that's, I think, again, has become very basic, which we have, right? And interestingly, I'll tell you, the behavior of people is changing, because earlier when we were thinking of that, can patient register themselves by using QR code? I think there were different views in the rooms where we're sitting and deciding. Most of the people said they're not well. Many of them are very aged people. Would they be able to use technology? So on and so forth. Trust me, out of 36 hospitals that we have, there are more than 15 hospitals where today the registration is 100% QR code led. Okay, and it kind of cuts across the age group. Second thing is that if I have done a surgery, or if I have met a doctor and I have to just show the report, can I just consult doctor over teleconsult? So that's another thing that they look for it, right? Further on, once I'm discharged, do we have the rehabilitative services? Do we have palliative services, right? All of that they look for. So today, patient is not coming to the hospital only for curative part, as we said, that they come for preventive, they come for curative, they come for rehabilitative, they come for palliative. So whatever size of hospital you are, if you want to retain your patients, then you have to kind of provide end-to-end service as much as possible.
I think these days we have a culture of people wearing smart watches, a lot of fitness devices. I'm not sure if people who use that have ever shared that data with their doctors. Because we're sitting on a lot of data, but then we are probably not making use of it in a good way. When we go to the doctor, we'll probably just tell our symptoms, but maybe we are sitting on a lot of data in terms of the fitness devices, but that is not shared. So I think that is also one of the way that preventive healthcare can be looked at when you share your own data, because this data is being captured at every day, 24 hours a day. So that's my thought process on one of the point. Next, Dr. Jagtar, my question is, I first talked about in the beginning I talked about townships, about the two families. Do you think that integrated townships are the answers? I know it costs a lot, but then imagine somebody working in the same campus. They have restaurants, they have a hospital, they have a workplace, they have their house, and they have an ambulance, they have everything there. The condition, the longevity of that person is much higher compared to anybody who's living in a non-township or a non-medicity area. What's your thought on that?
Well, Vinod, I'm treading on very dangerous ground when you ask me that question, because I have to be very careful. I'm talking to an architect, I think. Okay. So, being in the medical profession, I can say that definitely anxiety about the disease and then going to the doctor, whatever that we can do to take away from that in whatever manner, and whoever can take it away, be it the infrastructure, be it the technology, be it the environment, be it the manpower, anyone, it's welcome. So, in that manner, any person who is in a situation where he has to make that extra effort, that extra kind of time, take that time to reach a medical facility, will have that added anxiety. So if we are going to design a health city, as we are looking at, right, as a part of the urban planning, which you have talked, which is not really my, forte in any manner. But if I look at it as a doctor, I would welcome that. Because it would make things easy for my patients. And it would be easy for me to sort of talk to them, treat them, and maybe follow them up. So all this is definitely important. And I would say that the efforts, as you rightly pointed out, have to come from the public side majorly. When we look at the roads, we look at the air, we look at water, whatever. And also from the side of us as healthcare providers, that we don't create that kind of an anxiety, we lessen that in whatever healthcare facilities that we are building or putting in place to treat our patients. So that's very important. I think it's a great amalgamation which has to take place at efforts from maybe the top down and from the bottom up, which will actually see us somewhere around the corner towards healthcare city. Here I would, being from the army background, I would just like to draw your the audience attention. We have cantonments. Now cantonments are like districts in a city. But if you look at an ecosystem of a cantonment, it is so well contained, so serene, so peaceful. And not that I am trying to pat myself on the back, but I would give it to the, our forefathers, our, ancestors, who looked into this, providing this ecosystem for a soldier and his family. If you look at a cantonment, good green spaces, good playgrounds, good marketing facilities, good hospitals, good other healthcare facilities, good transport. Everything is available, which is making the life of a soldier or his family easy and taking the anxiety out of it. So we have these examples with us. We probably need to, expand them and possibly put them on a wider canvas. That's all I would like to say. Of course, there are other international examples of a city like Copenhagen and Singapore, but those may be way out. We can start small and look at our own conditions and our own environment to take care of. That's all I have to say. Thank you.
Ms. Nivedita, one last question, and it'll be a very short one. What are the biggest mistakes that hospital developers make in sustainability planning?
So one of the mistakes which the developers make is they generally think of sustainability as an afterthought, but rather the sustainability should be considered right from the initial planning and design stages. This is majorly because if you look at many hospital projects, the discussions related to sustainability come up after the architectural design and the engineering design is finalized. And at that stage, we lose out on many opportunities related to the site planning, related to the building optimization, related to the energy and water optimization. For example, if you take, if you analyze the building at a design stage, if you analyze the various building envelope, you will be able to understand what is the heat load to these various facades, and it can help in optimizing the kind of materials you choose for the facade, which will help in reducing the heat ingress. So when you're reducing the heat ingress within the building, this will help in optimizing the HVAC system which you're using part of the building. So it brings down the cooling load. So when you're bringing down the cooling load, it can also help in reducing the operational cost. So that is one of the mistakes. And the other one is generally the developers focus a lot on the upfront capital cost and overlook the lifetime performance. So it is important because these hospitals run 24/7 and they also are in operations for decades, nearly 50 to 60 years. So it is important to select the systems which are efficient, like your HVAC systems, your energy systems, your water systems. All of these, you need to look into the efficiency of this, even though there might be a little higher initial investment which comes into place, but there is going to be a lot of savings during the operational phase. So this is often overlooked because they concentrate on the initial upfront cost. And the other third aspect is the resiliency. So all of us know the importance of resiliency because of the recent pandemic which we face, COVID-19. We know that resilience is very important. So if you look at hospitals today, they are majorly designed for their current operations, and they often overlook the future health emergencies which might come, future climate crisis, future energy or water scarcity which might happen. So these are often overlooked. So it is important to design buildings which are future ready, which are more adaptable and which are more resilient.
Okay, so as we come to a close, I think from today's conversation, one thing is very clear, that hospital is no longer confined within the walls. The healthcare is no longer confined within the hospital walls these days. A city needs to integrate prevention, sustainability, accessibility, and resilience into everyday life. Only then the citizens can live a healthier and a longer life. And the future belongs to those cities which can integrate all of this into everyday life. And I believe the one takeaway from this session is that we all believe, we all should believe that a hospital could be a repair shop, but then a health city is a lifestyle. So as long as you are somewhere closer or living in a health city, or maybe in the future there's a health city coming up, and if you're living somewhere closer to that, you will probably be living a healthy lifestyle. Not much getting into traffic, not breathing polluted air, clean water, clean drainage system and everything. Until that happens, we will probably hope and will probably work towards that goal of building better healthcare infrastructure. We'll do all that we can do in terms of prevention or in terms of the curative part of it. But then at the end of the day, we all know that prevention is better than cure, and then we'll probably keep having more and more conferences like these to increase awareness among people. So thank you very much, everyone. And at the end of this session, I would like to thank the organizer, HPIE Medgate today, and all the audience for being with us till the end. Thank you.
Such an insightful session. May I now request Vivek Desai sir to facilitate all the panelists. Please welcome him on the stage with a big round of applause, everyone. Dr. Vinod Singh, founder and consultant, Hospitec Healthcare Consultancy Private Limited. Rajiv Kumar Jain, Senior Advisor, One Health FPHS. Richa Singh Debgupta, Group Chief Strategy Officer, Fortis Healthcare. Major General Dr. Jakhtar Singh, VSM, Executive Director, AHA. Nivedita Dilip, Associate Councillor, CII, Indian Green Building Council. Give them a big round of applause, everyone. Building Council.